So we'll just move through this. I'll just take you through, I guess, a little bit of the background of who Five Good Friends are, and also then just in regards to the service department offering and how you can use a home care package to actually offset the levies in the service department, which is a fantastic offering. And I think if more people knew about the service department offering, I think they'd be in hot demand. I know in some of the villages there, the occupancy is high, and some of the villages have got some vacancies. So how do we attract people into the service departments, and how do we explain to them how they can actually use a home care package to support the levies in those apartments? I guess the other thing too is just about how do we access a home care package, the importance of accessing a home care package possibly in the community or even in an independent living unit, so that it's an easy transfer across, and the actual funding and financial side also becomes really simple to apply to the levies as well. So I'll just quickly take you through who Five Good Friends are. So Five Good Friends are one of the care partners that have partnered with Stockland, and we offer services right across the country. We just haven't gone into WA as yet. So there's a couple of villages over in WA that we haven't gone into have service departments. The question that we quite often get asked is, well, why are you guys called Five Good Friends, which always triggers some interest. The reason we are called Five Good Friends is based off the back of a National Geographic study that was done in some sectors in the world that were showing clear and really happy lives being lived by people well into their 90s and a few into their hundreds. So the study started looking at why these people were living these long, happy, healthy lives, and look, not a lot of it is rocket science. They were all eating a plant-based diet, or most of their diet was plant-based. They were all moving every day, so I'm not talking about jumping around doing, high energy. They were actually doing lots of functional movement, so walking and moving around their community. And one of the other factors was that they had 5 to 6 really great friends that supported them through their life, through their triumphs and sometimes through their challenges. So we've applied that name, Five Good Friends, to our organisation because we truly do believe in the power of friendship, and we truly do believe in the stress-shedding power that friendship can also bring. So it's a lovely story to tell people, and it is very much at the centre and the ethos of everything that we do each day. One of the things that we found in the retirement space is, people who are living in retirement communities are great planners. They've made a decision to either downsize or go into a community for safety reasons or various reasons they might have chosen to move into the retirement space. So having a plan to retire is fabulous, but not actually looking at, well, what happens if my health starts to decline? And that's the piece that people don't seem to give a lot of thought to. And look, hopefully their health remains strong and they don't have to worry about a decline in health. But it's good to know what is out there for people who may need to look at alternatives to help keep them feeling supported in their independent living units. And also that also encourages people to potentially move into the service department offering, because they don't have to worry about their meals, they don't have to worry about their cleaning, and they don't have to worry about their laundry in some instances. So Five Good Friends' mission has very much been to go out and educate people in the retirement space about what it means, or empower them with information, but what it means if their health does deteriorate and they do need a little bit of extra support. And also to debunk the myths of actually accepting support and feeling like you're failing by doing that, which is absolutely not the case whatsoever. There's actually research to show, which I'll allude to in a minute, that shows that people who take support into their homes, every extra hour can decrease the likelihood of entry into residential aged care. And just going back on the slide before too, Ita Buttrose has actually looked after her father who had dementia, and part of that was her finding the aged care system really hard to navigate. And she is our ambassador, so she works really closely with our management team to help steer us in the right direction, and I guess all of the things that she hears out in the community as well that she shares with us too. So I guess the difference between, simply getting older and aging well is all about having a plan, being empowered with information and being able to make sound choices. So we try and encourage residents of the Stockland villages and also the staff to have the conversation. And obviously, you guys are all busy, or the village staff are really busy running the villages. So if the conversation needs to be had, you can actually access us very easily. And I'll share that with you at the end of this presentation. So one of the first things that we encourage people to do is obviously have the conversation. Then we look at, well, is the person eligible for potential funding? So we can go through the My Aged Care portal and log all of their information to organise an assessment for them. And we can also look at other different pathways to care if that's not the right place for that particular person. So as you would have heard, and it's been, I guess, a very controversial year with the Royal Commission and also with COVID, which has really put the aged care system under a spotlight, which is a good thing. I think, many aged care providers, and that's been seen very clearly in Victoria, where we've had the aged care outbreaks, have, rested on their a bit of complacency in some parts. Not all operators are doing the wrong thing. We've just got a few who didn't have their policies, procedures and staffing in good order to deal with a pandemic. And we've also got the government really highlighting the importance of people staying in their own homes. So the government wants people to stay in their own homes and wants to help assist them do that by the home care package program. And as you've probably heard there, once that home care package program was changed into a consumer-directed environment, the supply of those packages certainly wasn't meeting the demand. But they have slowly moved into getting that right. And just in the last budget, they've released another 23,000 packages, which clears a little bit of the wait list. And I think once the Royal Commission sort of gives its information up next year into its recommendations, I think that they'll try and clear that waiting list. That's anyway the word on the street. So hopefully that's what happens. And we've also got lots of other people who are doing it privately, or a combination of doing some private and some topping up. So I'm just going to quickly cover on how you can access the home care package funding, or what the sort of process is. And the process generally is, if you're deemed eligible for some form of government support, your details are logged through the My Aged Care system. There's a portal now, a government portal that everybody needs to go through, and it can put you into two streams of funding once they ask you a series of questions to establish exactly what your needs may be. The first stream of funding is council funding, it's traditional council care, and it's called Commonwealth Home Support. It's not just councils who are delivering this support, it's also some of the aged care providers. And you will be assessed by a regional assessment service if this is the stream of funding that you're deemed eligible for. Then the little step up, which is a more comprehensive care plan, which is designed for people who need higher levels of support, is the home care package program. And in this instance, you'll actually be assessed by an aged care assessment service. So those two different streams of funding are assessed by two different assessment teams. In the home care package stream, you'll be deemed eligible for a level 1, and you'll be allocated funding that looks like this. So for a level 1 package, you have approximately $9,000 that the government, labels or gives to you. Doesn't give to you actually, gives you the option to spend, and that's where the provider steps in and actually supports the use of that. Then at the level 2 package, you'll have approximately 15 or nearly 16,000, level 3, 34,000, and a level 4 package, 52,000. So significant amounts of money that you can use to support you in your own home. So this is just where I mentioned before that every extra hour of help that you receive in your home each week when requiring assistance will reduce the likelihood of resi care by 6%. And that was a study done by Macquarie University in the Journal of Post-Acute Long-Term Care Medicine. So there is actually some research to support accessing that help in your home. So just in regards to the 5 Good Friends model, we are a modern home care business. We do things slightly differently very differently to the traditional care providers out there, but we do at every sort of step of the way have you and your family at the centre of that help. We also have some great technology, which again, it doesn't have to be used by the consumer themselves, but there is a consumer-facing app that you can access to see when your carers or your helpers are coming in at your home. And our helpers use this also to check in and check out of your home when they're coming in to deliver services. We also have a remote care intelligence platform, which is called Lookout, which actually analyses the notes helpers are entering into that app and trying to detect any deterioration or risk that might be evident in that in those notes that are being sent through. And that is showing, a decrease in the likelihood of premature entry into residential aged care and also admission into the hospital system as well. So some of the services that you can get in your own home, so there's domestic assistance, personal care, you can access nursing and allied health, you can access transport. One of the highest requested services for us is actually companionship. And that can sort of go around a whole lot of things. So getting people out to the shops, getting people to their community groups, or just taking people out for a coffee, or taking people to the movies, actually taking them out to do the things that they want to do and things that they love that keep them happy and contented and remaining living in their own homes, and also to combating loneliness as well. And there's also some great technologies that you can access through your home care package as well, some smart home monitoring technology as well. So I guess the big message in that is all about early intervention means that we can deliver better health outcomes. So don't be afraid to actually have the conversation about how to access care and support in the home. So on the package, one of the big things that it can do is actually help you pay for your levies in the service that Stockland have as an offering. So just a quick recap on where those service departments are. So obviously Victoria's got a high number of those service departments, but they are across the country. And if you live in a village that doesn't have a service department offering, you can look at the villages that may be close to you that you could potentially transfer into. And the sales team and the village management team at Stockland would be able to support you through that. So this is the part where I can explain how you can actually use these home care package funds to support your levies in the service department. So this is just an example. These are arbitrary figures, arbitrary numbers, but just even numbers to make it as easy to understand as possible. And again, if there's any questions after this, I'm really happy to answer them. And also, if you want to contact our support centre, I'll give you the number for that, and there's an email address too that you can contact to ask any questions that you might have. So if you were living in a service department and your monthly levy was $1,500, some of the services that are supplied to the service department, such as your food and catering, we need Stockland to break this down, which they do, and we can't pay for the supply of the food, but we can pay for the preparation of the food. So they would give us a broken down cost of how that works. The other part that can be funded by the home care package is cleaning, laundry, and if there's an alarm service. I know a lot of the villages have INS alarms, but there are a couple of villages that have a different system. So the home care package can actually cover those costs. So if you're paying $1,500 per month normally without your home care package applied, and they've broken it out for us as a $600 for food preparation, then we've got cleaning at $90, laundry at $5, and INS at $5. That's $600 plus the $95 and $5 totals $700. So we can actually cover $700 of your $1,500 with the home care package. So your levy ends up being $800 a month, and you end up with $700 extra in your pocket. So it's a great way to use your home care package funds. And if you have any excess funds over that $700 in your package, you can also use that on services. So if you wanted someone to come and take you shopping, or you wanted someone to do a bit of extra cleaning, anything that you might like that supports you staying at home, we can also do a blended model as well. So if you had the home care package, we would sit down with you and say, here's a couple of your options, or sit down with you and your family, whatever suits. So I'll skip through this, but this just shows you how much funding you can get per year, which can actually contribute to paying those levies. So the next step that we would advise you to take would be, if you don't have a home care package, contact us and we'll guide you through the process if you are eligible. And we can also take you through the process, through different processes if we don't feel eligible for the home package. We would also discuss with you, if you do have a home care package currently, how you can offset those service levies and how you can utilise support through care, equipment or allied health. You don't have to offset the levies. You can do whatever you choose to do with those funds. And the one thing too is, once we start having those conversations with you, we can develop a tailored plan that suits your needs. So if you decide, even just for some private assistance, if you're living in the ILUs or the service departments, we can help you with that. So I'll give you, this is the phone number that you can ring and contact our care advisors. It is a free service, and day in, day out, they're supporting Australians over the age of 65 in the home care package program, and they're also supporting the disability scheme pre-age 65. So there's a great team there that speak this language day in, day out, and they would be happy to support you through any of the questions that you might have, big or small. And then there's also an email address if you want to reach out to them via email, and it's just care@fivegoodfriends.com.au. And once again, same, the care advisors are actually picking up those emails, and they would just come back to you, whether it was making a time to call you or whether it was just continuing a conversation via email, whatever works for you.